So what we're gonna do is it's gonna go up your nose and down into your stomach. I'll give you instructions when to swallow, and that just helps that it goes straight into your stomach and not into your lungs. We wouldn't want you to aspirate. But it will be a little uncomfortable, so if you do feel nauseated, just raise your hand, and I got a emesis basin here. If you need to, you can just do that there. Or if you just feel like you need a break, just go ahead and raise your hand and we could just stop there for a second, give you a break, and then we'll continue. Do you have any questions with that? And then, are you still feeling nauseated? Doing better? Have you vomited? No? Okay. I'm just gonna look at your stomach. It is distended. Just gonna listen to your bowels. So they are hypoactive. And then I'm just gonna press on your belly. You let me know if it's tender or if it hurts. That hurts. That too. There too. How about there? It does? Okay. So also, do you have any history of nose surgeries? None? Okay. So what I'm gonna do now, I'm gonna elevate your head about 30 to 90 degrees. So when I first insert it, I'm gonna have your head tilted back, and then when it starts to go down, I'll have you tilt forward. But first I'm going to clean your nose with a washcloth and your cheek, and then I'm gonna dry it. And then I'm just going to skin prep it. Just put this over you. And then I'm just going to press on each side of your nose, and I'm just going to have you inhale. So go ahead and inhale. Inhale again. Okay, so it looks like the right side is a little bit bigger, so we'll go with that side. So we're going to just pretend this is about 30 ml, so I'll put 30 mLs of air. Okay, so Maria, this is the tubing. So I'm just gonna recoil it so it's not as stiff. And then I'm just going to measure it from the bottom of your earlobe to your nose, and then down to your xiphoid. Just gonna pretend the patient's a little bit bigger, so I'm gonna go all the way to 65. So from the earlobe to the nose, down to the xiphoid. And then I'm just going to lubricate it. Take this off. And we're just gonna pretend that that's staying in there. Okay, Maria, I'm gonna have you hold this water, and then I'm just gonna tell you when to swallow, and you'll just swallow. Okay, so here we go. So just remember to raise your hand if you feel like you need a break or if you're feeling nauseated. Okay, so here we go. In we go. Okay, now we're gonna have you lean forward. Okay, we're gonna have you lean forward, and we go. Okay, now we're just gonna have you swallow, 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 swallow. Okay, we're all the way in. Just go ahead, inhale, or take a deep breath. Okay. And then I'm just gonna check for any coughing or her skin color, and she's doing good. Can you open your mouth? I'm gonna check for recoil. It looks good. Okay, so now I'm just gonna make sure it's in the right place. I did hear a swoosh. The other way we could check if it's in the right place is we check the pH levels with the pH strips. If it's between 1 and 4, then it's in the right place, but if it's above that, most likely it's in the lungs. The other way is we could do an x-ray, and that way we could visibly see that it is in the right place. Okay, so now I'm going to take this to the nose. Okay. And then I'm going to kink this, take this off, put this back in, and I'm going to put it onto the suction machine. I'm going to have about 120 milligrams per mercury. And then I'm going to put this on the side of her cheek. And then pin it to her gown. Okay, Maria, are you feeling okay? Do you feel nauseated? Doing good? Okay, I'm gonna just take this off. I'm gonna just lay you down just for a little bit. Just gonna look at your belly. So it's still a little distended. I'm gonna listen to your bowels. It's still hyperactive. I'm just gonna push on your belly. Still tender there and there too, okay? And I'll just clean my area. And then I'll come in every 4 hours to check if she's feeling nauseated or if she's vomited. And then every 2 hours if she needs the help to do some oral care. Okay, just the other way. Here's your call light, lower the bed. Here's your table. And I'm gonna take my gloves off. Gonna wash my hands. Okay, now I'm going to demonstrate how to take a NG tube out. So I'm going to wash my hands. I'm going to grab my supplies. And then I'm gonna knock the door. Hello, I'm Coral. I'm the student nurse today. Can I get your name and date of birth? Okay, it matches. I'm gonna wash my hands. Get some gloves on. Lock the bed. And then elevate the bed. Okay, so have you been feeling nauseous or have you vomited? Okay, and then when was your last bowel movement? Did you have any diarrhea or any constipation with that? Okay, I'm gonna look at your belly again. So it's looking better, not as distended. I'm gonna listen to your bowels. Bowels are active. I'm just gonna press on your belly. That is feeling better. How about there? How about there? Okay, feeling better. Okay, so now I'm just going to get 20 mLs of air, and then I'm just going to make sure it's in the right place. By this time, she's off the suction machine for about 2 hours, and during that time, I would check if she has, I've given her some sips of water. So kink it. So I did hear a swoosh. Okay, so now I'm going to irrigate it or flush it. I'm going to pull out about 30 mLs of saline water. And then I'm going to do 20 mLs of air just to make sure everything goes down. And then I brought this, and I'm just going to take the tape off with it. Tape off here. Take this off your gown. Okay, and then I'm just going to count to 3. I'm going to have you hold your breath, and then I'm just going to pull it out. Okay, so 1, 2, 3. Okay, good job. Do you feel okay? Okay, here's a tissue. We'll clean your nose. Okay. Do you feel any nausea or anything? Okay. And that's how you do remove an NG tube.